If you drink coffee first thing in the morning, I need you to stop right there. Not because coffee is bad for you. It is not. In fact, by the end of this video, I think you are going to feel a lot better about coffee than you might expect. But there is one thing happening in your body every single morning that almost nobody talks about, and it could be the exact reason your blood sugar stays high. Even when you are not eating sugar, even when you think your routine is already healthy, even when you are doing everything else right and still not seeing the results you want. And what makes this so frustrating for so many people is that they are working hard. They are cutting back on dessert. They are reading labels. They are being careful about bread and rice and fruit. And then their numbers still come back higher than expected. And nobody can explain why in a way that actually makes sense. I am going to explain it today because the thing that most people are missing is not on their plate. It is in their mug. And I want to be very clear from the start. This is not about giving up coffee. This is not another video that is going to tell you your favorite habit is ruining your health and you need to cut it out immediately. That is not the message here at all. The message is simpler and honestly more useful than that. The message is that the way most people drink coffee, the timing, the order of things, what they add to it, and when during the day they have it creates a set of signals in the body that quietly push blood sugar in the wrong direction. And changing those signals does not require giving up coffee. It just requires understanding what those signals are. Once you understand that, the adjustments are very small and the difference they make is very real. So stay with me through this entire video. I want you to hear all of it because each piece builds on the last. And the most important part, the one where most people see the biggest change the fastest, is coming a little later on. My name is Dr. Megan Foster, and I have been working with patients dealing with prediabetes and type 2 diabetes for years. And one of the patterns I see again and again so consistently that it almost never surprises me anymore is this. A patient who is genuinely trying to manage their blood sugar, who is being careful about what they eat, who is making an effort, but who has never once thought to look at their coffee routine. Not because they are careless, but because nobody told them to look there. And when I walk them through what I'm about to walk you through, there is usually this moment where something clicks. This moment where all the little things that felt unexplained suddenly make sense. That is what I am going for here. Let me start with a foundation, because understanding the basics of how your body manages blood sugar is going to make everything else in this video make a lot more sense. I know some people might feel like they already know this part, but I find that most people only know a surface-level version of it, and the details actually matter when we get to the coffee conversation. So bear with me for a few minutes because this context is going to make everything click. Your body works constantly to keep your blood sugar in a stable range. Not too high, not too low. Your brain runs almost entirely on glucose, which is the sugar that travels through your blood. So, keeping that level steady is one of your body's highest priorities. It is working on this around the clock every single day, whether you're thinking about it or not. The main tool your body uses to manage blood sugar is a hormone called insulin. Insulin is produced by your pancreas, and its job is essentially to act like a key. When glucose enters your bloodstream after you eat, insulin is released and it opens the doors of your cells so that glucose can get inside and be used for energy. Without insulin working properly, glucose just keeps circulating in the blood instead of getting into the cells where it belongs. That elevated circulating blood sugar is exactly what we are trying to avoid. When this system works well, your energy is stable, your focus is clear, your hunger is manageable, and your body is processing food efficiently. When something disrupts this system, things start to feel off in ways that are sometimes hard to identify. A little more tired than makes sense, a little more hungry than you should be after a reasonable meal. That afternoon crash where you feel like you cannot function, waking up not feeling rested even after a full night of sleep. These are often signs that the blood sugar management system is under some kind of strain, and they get written off as just getting older or just being tired when they are actually telling you something specific. And here is where your morning coffee comes in. There is something that happens in your body every single morning before you even get out of bed. It is called the cortisol awakening response, and it is completely natural and completely healthy. Cortisol is often described as the stress hormone, but that label is misleading because cortisol does much more than just respond to stress. One of its most important jobs is to wake you up and prepare your body for the demands of the day ahead. Every morning, starting a little before you wake up and peeing about 30 to 45 minutes after you open your eyes, your body produces a natural surge of cortisol. This surge does several things. One of the most important things it does is signal your liver to release glucose into your bloodstream. Your body is essentially saying, "We are waking up. We need energy. Release some fuel." Again, completely normal. This is your body doing exactly what it is supposed to do. But now, here's where the coffee enters the picture. Caffeine, the active compound in coffee, stimulates your body to produce more cortisol. This is actually part of why coffee feels so effective at waking you up. But when you drink coffee right after waking during that natural cortisol peak that is already happening, you are not just getting the alertness effect of the caffeine. You are amplifying a hormonal process that was already in motion. Your cortisol goes higher than it would have on its own. Your liver responds by releasing more glucose, and now your blood sugar is elevated first thing in the morning before you have eaten a single thing. Your pancreas has to respond to that. It sends out insulin to bring those glucose levels back down. Depending on how sensitive your cells currently are to insulin, that correction can be smooth and barely noticeable, or it can be significant enough to actually push your blood sugar below a comfortable range before you have even had breakfast. That dip is what creates that mid-morning crash. That feeling where you were fine an hour ago, then suddenly you are a little shaky or foggy or so hungry you cannot concentrate on anything else. And what do most people do at that point? They reach for another cup of coffee and the cycle starts again. Now, here is why this pattern matters so much for blood sugar, specifically beyond just the immediate energy and crash experience. For people who already have some degree of insulin resistance, which is far more common than most people realize and can exist for years before it shows up on any standard lab test, this morning pattern of repeated spiking and correcting places additional strain on the system over time. Every time your blood sugar spikes unnecessarily, your pancreas has to produce more insulin to respond. Every time this happens repeatedly, your cells can gradually start to become a little less responsive to that insulin signal. And that decreased responsiveness is exactly what insulin resistance is. It is a gradual process. It builds quietly. And the daily morning habit of coffee on an empty stomach is one of the patterns that can silently drive it forward without anyone connecting the dots. The research I want to point you to here was published in the British Journal of Nutrition, and it looked specifically at what happens when people drink coffee on an empty stomach right after waking. The researchers found that blood glucose levels increased significantly in that scenario. The same people drinking the same coffee, but at a different time after eating something first, had a much more controlled and stable glucose response. Same person, same coffee, completely different outcome based on timing. That is the key insight that almost never makes it into mainstream health conversations. And what I find so powerful about this is that it puts the control back in your hands. It is not about your genetics. It is not about being someone whose blood sugar just runs high. It is about a very specific daily pattern that can be adjusted with very small, very practical changes. Before I go further, I want to ask you something. How do you usually drink your coffee? Do you drink it first thing in the morning before eating anything? Do you have multiple cups throughout the day? Do you add sugar or cream or a flavored syrup? Let me know in the comments below. I genuinely read through them, and understanding how people actually drink their coffee helps me understand what to focus on in future videos. Now, let me walk you through the specific mistakes that matter most. There are 3 main ones, and they build on each other in a way that I think will feel very clear once I lay them all out. The first one is about what you put in your coffee. Most people already have a general sense that adding a lot of sugar to coffee is not ideal when you are managing blood sugar. That part is not new information, but what most people underestimate is how quickly even a small amount works and how consistently that small amount adds up over the course of a day, a week, a month, a year. When you add sugar to your coffee, you are not just adding sweetness. You are creating a rapid rise in your blood glucose. That rises fast because liquid sugar, especially without much fiber or protein or fat to slow down its absorption, enters your bloodstream quickly. Your pancreas responds by releasing insulin. And depending on everything else going on at that moment in your body, especially if you are already dealing with the morning cortisol spike we just talked about, this additional glucose hit creates an even bigger combined effect on your blood sugar. 1 teaspoon of sugar sounds small, and by itself it is. But 2 cups of coffee a day, each with a teaspoon of sugar over the course of a week, a month, a year, is a very consistent and very repeated input that your body is managing every single day. Your system is responding to that dozens of times a week, every week, all year. And then there is the question of artificial sweeteners, which is where it gets a little more nuanced and a little more surprising. A lot of people who are actively working on their blood sugar have already made the switch from regular sugar to some kind of artificial sweetener. And the logic is completely reasonable on the surface. No sugar, no spike. Problem solved. But the research on artificial sweeteners tells a more complicated story than that simple logic suggests. There is growing evidence that certain artificial sweeteners, particularly some of the most widely used ones, can affect the composition of the bacteria living in your gut. And your gut bacteria play a bigger role in blood sugar regulation than most people realize. They influence how efficiently your body breaks down and absorbs carbohydrates, how sensitive your cells are to insulin signal, and even how strongly you experience cravings for sugar and carbohydrate. Rich foods. So even without causing a direct immediate glucose spike, disrupting that bacterial environment can have downstream effects on your metabolism that are meaningful over time. Does this mean that one packet of sweetener in your morning coffee is going to cause a serious problem immediately? No. The science here is still developing, and individual responses vary considerably from person to person. But what it does suggest is that the safest and most reliably beneficial choice for most people is to work toward plain coffee without added sweeteners of any kind. If that feels like too big of a jump right now, small amounts of natural stevia, the kind that comes from the actual plant rather than a heavily processed version, appears to have a much lower risk of the gut disruption effects that the synthetic sweeteners carry. I also want to be honest about something that comes up often, which is the idea that cutting back on sugar is essentially the same as cutting it out. If your goal is real blood sugar stability, cutting back is meaningfully better than not changing at all. But a small amount of added sugar, still 3 or 4 times a day, is still a regular glucose input that your body is responding to many times a week. If you are serious about giving your system the best chance, working towards zero added sugar in your coffee is the real target. The second mistake is about when during the day you have your last cup of coffee. This one catches people off guard because coffee feels like a morning thing for most people, and the assumption is that by afternoon the effects have fully worn off. But caffeine stays in your system much longer than most people realize. And understanding that changes how you think about this. The half-life of caffeine, which means the amount of time it takes for your body to clear just half of what you consumed, is somewhere between 5 and 7 hours for the average adult. Some people process it faster, some significantly slower, depending on individual factors. But as a general reference point, if you have a cup of coffee at 2 o'clock in the afternoon, a meaningful amount of that caffeine is still active in your system at 8 or 9 at night. Now, why does that matter for blood sugar? Because of the relationship between sleep quality and how your body manages glucose the following day. This is one of the most clearly supported findings in metabolic research over the last decade. Poor sleep quality. Even just a single night of disrupted sleep measurably reduces insulin sensitivity the following day. Your cells become less responsive to insulin's signal. That means blood sugar stays elevated longer after meals. That means your pancreas has to work harder to produce enough insulin to compensate. That means the entire next day your blood sugar management is compromised before you have made a single food choice. And caffeine in your system at bedtime, even at low levels, reduces the amount of time you spend in deep sleep. This matters because deep sleep is not just about rest and recovery in a general sense. Deep sleep is when your body does a significant portion of its metabolic maintenance. It is when your hunger hormones get rebalanced. It is when your cells essentially do a sensitivity reset. When you are consistently not getting enough of it, the effects on blood sugar regulation are real and measurable. I want to address a very common response here because I know many people are going to relate to this. You might be thinking right now, I can fall asleep fine after coffee. I've always been able to do that. I sleep all night. My body handles caffeine well. And I completely believe that you fall asleep. That is not the issue. The issue is what the quality of that sleep looks like after you close your eyes. Even if you do not notice anything different from the inside, caffeine can reduce the amount of deep, restorative sleep you get, even when it does not prevent you from falling asleep. You might sleep 7 or 8 hours and still not get enough truly restorative deep sleep because the caffeine in your system is interfering with the architecture of that sleep in ways you do not consciously experience. And the result shows up the next morning, not necessarily as tiredness, although sometimes it does. More often, it shows up as a slightly harder time managing blood sugar, slightly stronger cravings, slightly worse energy stability. Things that are easy to attribute to other causes because the connection to last night's coffee feels too indirect. The fix here is simple, and it does not require giving up afternoon coffee.